breast augmentation. From the dawn of time, breasts have been the main feature of femininity. Having breasts which are proportionate to the rest of the body is something which many women want. With a simple procedure, you too can achieve a more attractive shape. A lack of volume or sagging breasts are the main reasons for undergoing breast augmentation mammoplasty. It is vitally important to hold a frank, open discussion with your surgeon. During the visit, tell him what you want and expect from the surgery. After taking down a full medical history, you should highlight any problems there may be as regards blood clotting, any medication you are on, and your own and family history of breast disorders or pathology. The surgeon should examine and see the size and position of your breasts and how asymmetrical the breast tissue, areolas, and folds under the breast are. We also have to evaluate the size and shape of the chest wall, how it relates to the waist, and your height and weight. There are 3 ways in which implants are inserted: from under the breast, from around the areola, and from the armpit. If it is inserted from under the breast, a small incision will be made in the fold under the breast. The incision will not go further than the vertical of the medial edge of the areola. Then, without penetrating the mammary gland, the surgeon gains access to the breast muscle. If the breast is full, then the implant may be placed in front of the pectoralis muscle. If the breast is empty and there is little breast tissue, then the implant would look obvious, and therefore a pocket is created under the pectoralis muscle, a submuscular pocket. There is a further option, which is to place the implant between the muscle and its fascia, which is known as a subfascial pocket. The same procedure can be performed by making an incision around the areola, although in this case we must make a subcutaneous dissection at the bottom end to reach the deep plane. Access from under the armpit requires making a horizontal incision in the armpit. Creating a place to hold the implant will necessarily be done under the muscle and is performed using a flat dissector. Technological advancements have brought about a tremendous improvement in the implants used in breast augmentation. From the liquid silicone implants used in the past, we've evolved to implants filled with cohesive silicone gel, and this type of filling is generally considered to be the best available today. By increasing the degree of cohesiveness, silicone gel has the great advantage of keeping its shape without making it hard to the touch, so the implant does not wrinkle. Because we walk upright and are subject to gravity, it also has the advantage of preventing the upper part of the breast from emptying, which gives it a very natural shape. Teardrop cohesive silicone gel filled implants are manufactured in different heights and projection and breast base. It was the base that generally limited the choice of implant size. Now we no longer suffer from these limitations. With the same breast base, we can choose between 3 different heights of filling for the upper end of the breast and 3 different projections. This gives a very natural effect and changes the degree of filling of the breast cup or projection. We would only use round implants with a high profile of cohesive gel if the patient wants to have a breast with a very rounded upper pole. The end result would depend upon the proper 3-procedural approach, personalized study, and a frank and open discussion with the surgeon.